Northern Light Health is one of the largest healthcare providers in Maine, and it's in trouble.
What started with Eastern Maine Medical Center in Bangor and a few smaller hospitals a couple of decades ago, Northern Light Health now runs hospitals from southern Maine to Aroostook County, including Mercy Hospital in Portland. It employs around 10,000 people. Northern Light is on track to lose $100 million this year and is now holding $620 million in debt. On top of that, just this month, 3 top executives resigned and a credit rating agency dropped Northern Light's score. Today, News Center Maine's Katie Delaney got the chance to speak with Northern Light's chief financial officer about how the organization plans to stay afloat.
Northern Light Health's chief financial officer, James Rorba, says some of the challenges that have contributed to their financial losses are labor shortages, rising inflation, and low reimbursement rates for MaineCare and Medicare.
Unfortunately, in rural settings in this country, healthcare since the pandemic has had a lot of financial pressure on it.
According to Rorba, with Medicare and MaineCare reimbursements, there's a $300 million difference each year between what it costs to care for patients and what Northern Light is paid.
It's challenging, and why it's challenging, 66% of our patients are Medicare or MaineCare.
With Northern Light's financial losses increasing, many are concerned about the direction the healthcare provider is going.
It's heartbreaking to see, it really is. They need to start involving the community more in some of the decisions that are made, and trying their darndest to recruit locally.
To address labor shortages, Northern Light is partnering with colleges and other organizations to bring more nurses into the workforce and is hoping to expand those programs. Rorba says they're also seeking to lower administrative expenses to focus on patient care. This includes recently eliminating 2 executive positions.
We are going to keep working at the things that we can do to improve the quality of healthcare.
Another strategy of Northern Light is sharing resources across the healthcare system and forming partnerships. The company recently announced it will be partnering with Compass One, which will facilitate food and environmental services for the hospitals.
That can bring, a lower cost to a service, can bring, higher quality or efficiency around services that they provide.
When it comes to reimbursement rates for MaineCare, the state legislature has been able to increase these rates, with Northern Light expecting to see a $17 million improvement next year. State Senator Joe Baldacci says the legislature should do more to fund health care.
This is a problem that's happening to hospitals around the state, and that we need to fix, because we need to have a stable healthcare system.
Rorba says they'll need to continue adapting to meet healthcare needs in Maine.
These are our hospitals, this is our community, and so it's critically important that we make sure we're doing everything possible to make sure that we're successful and sustainable for the future.
Rorba says he's excited to continue working through these challenges and collaborating with the state and federal government to figure out solutions. In Brewer, Katie Delaney, News Center, Maine.